Welcome. My name is Peter Strong. I specialize in online mindfulness therapy, which I offer via Skype. So if you're looking for Skype therapy sessions with a mindfulness therapist like myself to help you better manage anxiety or depression or addiction or OCD or any other psychological problem that responds well to mindfulness-based techniques, then I do invite you to contact me. There's no obligation, just simply email me and tell me more about yourself and the particular problems that you're dealing with, and ask any questions that you may have about Skype therapy sessions for treating anxiety or depression. This is a very effective approach for most people. Skype therapy is just as good as seeing a therapist online for the vast majority of people. You need to have Skype or similar video type interface so that you can see each other. Being able to see each other is really important for effective psychotherapy. So as long as you can see each other, there's really no difference. And especially if you're looking for practical methods that you can use yourself for working with your anxiety or depression. Most people really need to learn how to work with their emotions more effectively. This doesn't need treatment as such. This just needs better methods and tools. And that's what I will teach you during our Skype therapy sessions together. I will teach you how to work with your anxiety or depression or addiction or intrusive thoughts or whatever it might be, using the well-tested methods of mindfulness therapy. Many of these techniques I have developed myself over the last 10 years, and people are incredibly happy with the results of the mindfulness methods that I will teach you. You can read more about some of these results in my testimonial page. The testimonies there are from real clients, and most of them have already tried conventional talk therapy and medications, usually with very little success. But once they start taking charge themselves of their recovery process, using the mindfulness-based tools that I teach, people see much better results in far fewer sessions. Typically, people see substantial improvements after the first 3 or 4 sessions. Good psychotherapy should not be a long, drawn-out process. You should not be seeing a therapist indefinitely for years, as has been the case with some of my clients. That is not acceptable in my opinion. That just means that the therapy process is not working. You should expect to see substantial improvements in a far shorter time than that. Like I say, if you don't see substantial improvements after 3 or 4 sessions, then you should stop seeing me or any other therapist and find something that works better. Many of my clients have tried medications for their anxiety or depression, and usually they don't really seem to work very well, and they certainly seem to lose effectiveness over time. And there's a good reason why medications are not the preferred treatment for anxiety or depression, and that is because they do not change the underlying psychological and habitual processes that cause your anxiety or depression or addiction or any other form of emotional suffering. Medications will not change the psychology of your anxiety or depression. Medications are really nothing more than a band-aid that can provide temporary reduction in the severity of symptoms. But medications will never treat the underlying cause of your emotional suffering. If you want to really change the underlying cause, if you want to free yourself from anxiety or depression, then you need to address the underlying psychological process. That is the primary focus of mindfulness therapy and my philosophy in general. It's about getting to the root of the problem. So the first thing that I will teach you during the first Skype therapy session is how to change the relationship that you have with your emotions. This is critical. The primary problem that I see over and over again is that people become blindly identified with their anxiety, depression, or guilt, or shame, or anger, or stress, or whatever it might be. They become identified with these emotions. They basically become overwhelmed by the emotion. They become lost in the emotion, and then they become lost in the reactive thoughts that feed that emotion. So this is a critical first step, is to overcome that process that I call reactive identification. You have to learn to see your emotions objectively. You have to develop objective consciousness so that you can observe your anxiety or depression without becoming lost in it, without becoming overwhelmed, without becoming consumed by the emotion and its associated reactive conditioned thoughts. So developing this is a central feature in mindfulness therapy. We technically refer to this as developing equanimity. This is one of the primary features of mindfulness. Equanimity, non-reactivity. Being able to basically see your emotions without becoming overwhelmed by them. This provides the very foundations for healing and changing that underlying psychological process that causes your anxiety or depression. There are other things that we do in mindfulness therapy and that I will teach you during the mindfulness therapy sessions that you will be having with me. And the next stage, if you like, of recovery and changing that underlying process that causes your anxiety and depression is developing friendliness and compassion towards your emotions. If you have a hostile relationship with your painful emotions, that will simply feed those emotions. If you try to avoid your painful emotions, that will feed them and it will stop them from healing. So we have to reverse our whole relationship to our emotions, to being one based around friendliness. And this quality of friendliness is another major characteristic of mindfulness. So mindfulness cultivates non-reactivity and it cultivates friendliness towards your emotions, These two qualities are essential for healing. When they are developed together, the healing is greatly accelerated. And this is really one of the reasons why mindfulness therapy is so very effective, because it understands that you have to develop this quality of relationship with your emotions, and when you do, they heal very quickly. The best analogy is to think about how you would help a child heal if they were suffering with some problem or other. You know from experience, you know quite naturally that what that child needs is your consciousness, your awareness, your attention, and your compassion, your friendliness. You need to embrace the child, and when you do that, the healing that takes place is very much faster. The child will stop crying if you exercise some compassion and show some attention to that child. Well, it's exactly the same principle that we develop in our mindfulness therapy. We have to learn to embrace our emotions in the same way that we embrace that child. This is what works. This is not some form of New Age thinking. This is what has proven to work over and over again. So this is why mindfulness is so powerful, because it understands the power of consciousness combined with compassion or love. So when you bring this to your emotional suffering, it really accelerates healing a great deal. So if you're interested in scheduling some Skype therapy sessions with me so we can explore how to use mindfulness to heal your emotional suffering, then please contact me. We can schedule some therapy sessions at a time that works for you. I see people all over the world. Most of my clients live in America, but I do see a lot of people in the UK and Europe, and as far away as Australia. So if you're interested in starting some online therapy sessions with me, please contact me. Thank you.